So this is our deep vein thrombosis. So when you see it in the hospital, everybody's gonna be like DVT, DVT. That's what we are talking about. We are talking about deep vein thrombosis. So as you can see from this picture, a normal vein, and as you can see, what ended up happening? An accident, right? An accident starts to happen. And then guess what? Blood starts to follow it. So you want to make sure that you just remember venous. When stuff is like with the venous, I'm really kind of thinking of just accident. So it's messing up the blood flow. All right, so DVTs, this is one topic that you need to know. You need to know. You need to know. So with your DVT, what actually is a DVT? It's nothing but a blood clot. It is a blood clot that develops in your large, deep vein of your limbs. And it normally happens in your lower limbs. And it can lead to a pulmonary embolism, which we'll talk about which we have talked about. I'm recording this in the future, but when you're reviewing this, we have already went over respiratory. So we went over pulmonary embolism. So guess what? I won't even go over it. So let's talk about some causes of it. So why does your blood why do blood clots actually happen? So blood clot actually happens if you have hypercoagulability, meaning that your blood is just prone to clotting, right? There are some disease processes that are prone to your blood clotting. Blood stasis, meaning guess what? Your blood is not moving. That's that car accident, right? And then you have vessel injury where some type of injury messed up basically the function of that vessel. So those are the causes of a blood clot. So you want to make sure that you are assessing your patient. And I think we talked about surgery already, that our surgical patients, that they are at risk for DVTs. Our symptoms, that patient may be complaining of a throbbing, cramping pain. They will have redness and swelling in that area, edema. They will have hard or sore veins, and they will have a larger calf diameter. So their leg will be like this, their calf will be like this. So those are some symptoms that you want to look for in that patient. Ones that's not on that slide is it will be warm. It'll be warm. It'll be hot. It will be hot. It also will be tender to touch as well. And sometimes if that patient had a blood clot for a long time, or if it is a bigger blood clot, it either can cut off circulation to an area. So let's say they had it in this area right here. When we check our pulses, let's do it right here. Let's say they had a blood clot right here. They check our pulses. You may check your pulses down here, and that patient may have a weak, thready pulse. So that's one thing you want to pay attention doing your assessment is, especially patients who have high risk factors. You want to make sure that you are assessing their extremities for sure. So we know that if a blood clot basically lodges from out of our extremities back up to our lungs, we now are at a pulmonary embolus, which is a serious matter. So you want to make sure that you're just assessing your patient and knowing the risk factors, knowing that these patients are at a high risk, and we're going to talk about that in a few. But how can that be diagnosed? Right, through medical history. Some patients are on medications that, like I said, cause hypercoagulability. Some patients have disease processes that makes their blood clot. So you want to pay attention to that. Some medications, as I mentioned before, that causes blood clots can be a signs and symptoms. Surgery. So how can it be diagnosed? If you really, really think a patient has a blood clot, they'll do an ultrasound. But if they really don't think they have one, but they still want to dot their I's and cross their T's and all that kind of stuff, then they can do a D-dimer test. So here are the risk factors for DVTs: travel and trauma. So let's talk about travel for a minute. So blood starts to pool, right, when you're in a dependent position. So traveling, such as airplane rides, sit in the car a long time, you're not moving, so blood is pooling, right? Blood is at a halt because we're in a dependent position. So you want to patients who travel and stuff like that, that's how you always see a lot of people that they'll get around and walk on the plane just to get the blood flowing in that area, right? Because blood is at a halt if we're in a dependent position and we're not moving. Hospitalization. Why hospitalization? Because patients are laying in the bed. They're not moving, right? So we definitely want to keep that in mind. Smoking, surgery puts us at a risk. Immobilization, sickness, all these different type of factors put us at risk for blood clots. So nursing interventions, what are you going to do to prevent a patient from getting a blood clot? On the next slide, we'll talk about what to do after a patient has a blood clot. So instead of putting the words on here, I'm just going to allow you guys to listen to me. But as you can see, the DVT in that leg versus the other one. So you see the difference? All right, so what are you going to do to prevent a DVT? So the biggest thing with DVTs is prevention. You want to prevent it. So we want to make sure that our patient are wearing their SCDs. So what are SCDs? They are our sequential compression device. So those are those leg pumps, and it's hooked up to a machine, and it pumps air into it, and it releases, and it goes like that, and that just keeps the blood flowing. Some places they use TED holds, which gives you like a compression to it. So you want to make sure that your SCDs, a lot of times patient will refuse these, but you have to let them know why they're using it, because sometimes they don't understand. We just sometimes say, hey, put these on, and they're like, I really don't want to wear these. Number one, some patients say they squeeze too tight, some don't like the noise, so you want to make sure that you're educating your patient. Also, you want to let your patient know that they need to be wearing these throughout the day unless they are walking. So you want to encourage your patient to ambulate if they can. So if your patient can walk to the restroom, we don't want them using a bedpan. We need you getting up. If your patient can get up, we want you out of bed while eating. You want to promote mobilization, getting blood flow to that area, right? All right, you want to teach your patient also about leg exercises. Let's say they are bed bound. You want to have them do leg exercises, you know, just to get the blood moving in those areas. And then we also have our prophylactic medications such as heparin or Lovenox. So you want to remember how to give heparin, how to give Lovenox, right? We're giving it in subcutaneous and we're giving it in the love handles. And you want to remember, when we're giving these anticoagulant medications, we want to make sure that we're monitoring for bleeding and different lab results, our platelet count, and all that kind of stuff we need to be looking at. So definitely a lot of patients refuse their Lovenox shot, but sometimes they just don't know the severity of a DVT. So you might got to scare your patient a little bit so they can understand the importance of taking these medications. But prevention is key. So if your patient has a DVT, you want to make sure that you do not rub or massage that affected extremity, because you can dislodge the clot. And if you dislodge the clot, it could go to their lungs, which could cause a pulmonary embolism. So we want to elevate the affected extremity above the heart, because elevating above the heart does what? It promotes blood return and decreases swelling. Ensure bed rest. We're going to get the pharmacological measures, so that patient will be on heparin or Lovenox. Compressions, warm, moist compression. It helps with pain and helps with circulation. So remember, warm causes vasodilation, right? Helps with circulation. Cold constricts. All right, so leg circumference measurements, make sure that you are measuring their leg, you know, to see if it's getting better or not. All right, and then you want to observe for some signs of PE, so pulmonary embolism. What are some signs and symptoms of pulmonary embolism? Shortness of breath, chest pain. We want to pay attention to those things. And then we want to wear the tight compression stockings per